A year ago, I left my job as a surgical resident, and I think
So I saw this video this morning and it made me really sad. And I've seen a bunch of this on TikTok lately where there's young physicians that are dropping out of or leaving the field of medicine because of the abuse they suffer as residents. And I think we're losing a lot of wonderful physicians because of the way we train people. So I remember when I was a surgical resident that I heard multiple times people kind of bragging that surgical residency had the highest dropout rates of any residency. And I think that's just not something to be excited about. This is a study from JAMA Surgery in 2017, and they found that the average dropout rate is like 20%, and it's higher for women than men. It was 25% of women and 15% of men. So 1 in 4 female surgical trainees drops out of their training program. We also know that female trainees have a really hard time having children during residency, and they tend to wait till afterwards and have more fertility problems. Female trainees are also treated much worse than male trainees and have a much harder time in their training programs. I often see in the comments on these videos, there's kind of a chorus of, you're lucky to have this opportunity, you signed on for this, you should have expected this, and that's just a horrible answer, you guys. Nobody signs on to be abused. All of these young people signed on to be doctors, and they want to take care of people. They love the field of medicine. They didn't want to be abused. And it shouldn't come hand in hand that if you're a doctor, you have to subject yourself to abuse during training. I often see female surgeons that will say things like, it made me better to be treated this way. And there's some kind of weird feminine machismo where they feel superior or better because they could get through things that were difficult, or they try to paint this picture that it's not that difficult for women, and that's just objectively false. I saw a post by Lady Spine Doc not too long ago where she was discussing kind of how us female surgeons sometimes romanticize what it's like being a surgeon, and I saw Dr. Arga Gonzalez also talk about this. And at first I was kind of like, being a surgeon is awesome. I love surgery and it's amazing. But I think the reality is that I am many years out of my training now, and I am in a situation where I don't suffer a lot of the abuse that some female surgeons in particular suffer at academic institutions or other places, and certainly that our young trainees suffer. And I would encourage female surgeons in all areas, quit the nonsense of the it made me stronger, and start making things better for female trainees. I mean, we really need to step up and do better for these young women as they're going through training. But this kind of post always just makes me so sad, because when I see it, everyone's supportive in saying, yeah, great job, do what you need to do for your mental health. But in my mind, what I saw is someone whose mental health took a hit, and we're losing a wonderful doctor because they weren't supported by their residency program. And that just is a really sad thing. So I hope that she figures things out and finds something in life that brings her joy and doesn't torment her the way surgical training did. But I still always feel in my heart sadness that we lose wonderful doctors this way.